When you can't walk, it's a huge deal. So I always talk to my patients about simple things like, do you have a couple steps in your house? Do you go to work? What do you do at work? Do you sit down all day? There's a lot of different things that I try to look at besides just what's going on with their foot. I've always been interested in medicine. My father was a dentist, so I've kind of been around patients my whole life. It was one of those things where I saw the ins and outs of it, and I like talking to patients and talking to people, and I figured I can't really talk to someone if you're working on their mouth, so. I want my patients to remember me just as someone that they could trust, someone that they could talk to, and someone that is easy to approach. The fun fact about myself is I like to cut my own hair. I figure if you're a surgeon, you should be able to cut your own hair. So that is one thing that I like to do. I cut my kids' hairs and I practice on them, so if I mess up, worst case scenario, you just shave it all off. I took one of those personality quizzes. There was three things that kind of tell you who you are, but my second one was a responder, which is essentially I like to respond to people in need and in help. I just enjoy the satisfaction of helping others. It's one of those jobs that's very rewarding, but I like to think about it as being a father. It's one of those things where you put your heart and soul into it and you do the best you can. You're not always going to get a thank you, but at the end of the day, it's worth it.